And now back to Roger Cooper and the American Health Journal.
Try as some people might, mints, mouthwash, and other aids aren't enough to cover their bad breath. There may be a lot more at stake here than meets the nose. To find out more, we went to Hoag Memorial Hospital Presbyterian in Newport Beach and spoke with Dr. Kenneth Zuckerman.
Bad breath can be initiated from several parts of the upper respiratory tract. We can see some patients who may even have sinus disease or nasal problems that can present with bad breath. Some people have dental issues that would cause them to have bad breath. Some people have some tonsil issues. We see patients who have what we call cryptic tonsillitis, where they get particles of food that may get caught in portions of their tonsils that can cause them to have bad breath. Some people can have tumors in their upper respiratory tract that could produce bad breath, and some people have gastrointestinal problems, stomach acid, reflux laryngitis, reflux esophagitis sometimes can cause bad breath. Well, I'd say the majority of people that I see with bad breath, I'm not able to ascertain it. I don't appreciate it. And there are certainly some patients that I see who I perceive to have bad breath, and that's not their complaint. But in the patients who complain of bad breath, we do a nasal examination, make sure there's nothing going on in their nasal cavity. Certainly we do an oral examination. Some people do have very poor dentition, which is grossly obvious when you examine somebody. Certainly someone can have a tumor in their oral cavity or their upper respiratory tract that we would potentially see. We have special scopes that we can look into the nose and down into the pharynx and the hypopharynx and laryngeal area. Fiber optic scopes that we could see if there's some irritation in those areas that potentially would be, or that would make us suspicious that someone may have some type of gastrointestinal problem that may cause it. Some people do have what's called cryptic tonsillitis, which is one of the more common reasons that I see people for bad breath. And sometimes it requires a tonsillectomy if someone is really aggravated by it. Usually we try more conservative measures initially, like gargling, and some people are able to get back and able to extract these particles from the back of their throat, and they do smell awful because they've been acted on by the bacteria that are in your oral pharynx. And they do sometimes collect in little cracks and crevices in the tonsils. But if that's unsuccessful, sometimes we will proceed with a tonsillectomy. I mean, if people are constantly confronted by other acquaintances that they are having bad breath, then people become certainly self-conscious about that and tend to shy away from social interaction with other people. So it has pretty significant consequences. The patients that complain of it are somewhat distraught by it, and it's certainly important to try to come up with a solution for it. It's not always readily apparent from some people. The issues that I raised, or the etiologies that I raised, are not always present in most people, and in some patients it's very difficult to come up with a definitive solution for it. I think most people who come to the doctor for bad breath are not coming because of themselves. They come because a family member or an acquaintance has complained of their breath. So I believe if somebody has gotten numerous complaints about their breath, then that would be someone who would probably show up at a doctor's office. Because a lot of people with bad breath don't really appreciate it until they're confronted by someone who complains about it.